Okay, well, good afternoon and welcome to the virtual information session with candidates for the Ottawa South riding. Bonjour et bienvenue à la séance d'information virtuelle avec les candidats de la circonscription d'Ottawa-Sud. Mon nom est Jean-Claude Bouchard and I am a director of the board of the Ottawa branch of the National Association of Federal Retirees, and it is my privilege and honor to serve as your host facilitator for today's session. This series of virtual information sessions with candidates, one in each of Ottawa's 8 ridings, is the result of a strong collaboration between the National Association of Federal Retirees, the Ottawa chapter of the Canadian Association of Retired Persons, and the Council on Aging of Ottawa. Cette série de séances d'information virtuelles avec les candidats, une dans chacune des 8 circonscriptions d'Ottawa, est le résultat d'une solide collaboration entre l'Association nationale des retraités fédéraux, le chapitre d'Ottawa de l'Association canadienne des individus retraités et le Conseil sur le vieillissement d'Ottawa. I would like to thank the members of our 3 organizations for attending today's session. Before we go further, I would like to acknowledge that the land where our 3 organizations are located is traditional unceded territory of the Algonquin Anishinaabe people. Our association, CARP, and the Council on Aging were eager to work together to make these meetings happen. Our goal is to give the members from our 3 organizations, representing over 44,000 seniors in Ottawa, the opportunity to hear local candidates address key issues that have a significant impact on seniors. All 3 of our organizations are advocacy organizations. We advocate on behalf of you, our members, so you can experience a safe, secure, and healthy retirement. We believe it is our role to help you make well-informed decisions about the future. Nos 3 organismes s'occupent de plaidoyer. Nous plaidons au nom de nos membres afin qu'ils puissent vivre une retraite sûre, sécuritaire et en bonne santé. Nous estimons que notre rôle consiste à les aider à prendre des décisions éclairées au sujet de l'avenir. We encourage our members to have their say in the upcoming election and to vote. There are a variety of ways to vote this year, and these are described on the Elections Canada website. I want to warmly welcome the candidates who are here with us today to address these issues. Today we have with us David McGuinty, the Liberal Party candidate, Uda McBill, the NDP Party candidate, Les Schramm, the Green Party candidate, Shiloh Hall, the People's Party candidate, and Larry Waslin, the Communist Party candidate. Please note that Eli Tanis, the Conservative Party candidate, had to cancel for a personal matter and he regrets being absent in person. He has provided a video and we will play it. Each candidate will have 5 minutes to speak in person or on tape. Next, I would like to take just a few moments to introduce our collaborators and give them the opportunity to speak briefly about their organization. I would like to introduce Claude Paul Potvin, who brings greetings as a director of the Ottawa chapter of CARP. Claude Paul, je t'en prie.
Merci Jean-Claude et bonjour à vous les candidats et salutations chaleureuses aux membres de nos 3 organismes. My name is Claude Paul Boivin and I serve as a member of CARP Ottawa's Board of Directors, which is one of 25 chapters across Canada, serving over 350,000 members. So we are the largest seniors advocacy association in the country, and it is our goal that all seniors and retirees have a good quality of life in their later years. Notre grande priorité est la qualité de vie de tous les aînés. CARP offers numerous benefits and programs, and in Ottawa, during the pandemic over the last year and a half or so, CARP has organized some 50 virtual seminars or webinars, on different topics that our members have identified as important to them. We hope to be back together in person soon to celebrate the end of the pandemic, or at least a new normal, and enjoy the collegiality that our workshops and exhibits brought and provided to all seniors in the region. Our board of directors has been working diligently over the last year on two priority advocacy projects, one on long-term care facilities and the other on fall prevention. And we believe we are making great strides to influence politicians and bureaucrats alike to effect change. We're very pleased to collaborate with COA and NAFR on these all candidates meetings. Alors, en conclusion, au nom de tous nos membres, je souhaite une bonne fin de campagne à nos candidats, and I want to thank all the candidates being so willing to serve our country. Merci, and back to you, Jean-Claude.
Merci beaucoup, Claude Paul. Now I would like to introduce Yves Leduc, who is a director on the board of the Council on Aging, and who also serves as the Council's Chair of Community Engagement. Alors, Yves, s'il vous plaît.
Merci Jean-Claude et bonjour à tous les candidats. Et j'aimerais aussi souhaiter la bienvenue à tous les participants qui ont pris le temps de se joindre à cette rencontre virtuelle aujourd'hui. My name is Yves Leduc, and I have been appointed to the board of the Council on Aging of Ottawa this past summer, after having spent close to 30 years working for a lobby organization, primarily in the agricultural sector here in Ottawa. Le Conseil sur le vieillissement d'Ottawa est un organisme bilingue à but non lucratif, voué à l'amélioration de la qualité de vie de tous les aînés. Et ici, on parle à travers les différents stades du vieillissement, donc dès la cinquantaine jusqu'en fin de vie. The Council on Aging of Ottawa is a bilingual, volunteer-based charitable organization dedicated to improving the quality of life of older adults living in Ottawa. We strive to promote and champion the basic tenets of an inclusive, caring city and the importance of community-wide engagement with a special focus on the vulnerable and isolated older adults. Concerns and issues of older adults are identified, and solutions are sought through various means such as forums, research projects, and partnership network. And the session that is being organized today as part of a series of 8, I think is a good example of how the three associations are able to coordinate. J'aimerais maintenant partager mon expérience personnelle en lien avec les centres de soins de santé de longue durée. I would like to share my personal experience with long-term care home. Over the past 6 years, my two parents have transitioned from their home, from their house, to a long-term care home, where unfortunately both have ended their life there. So my mother passed 6 years ago, so well before the pandemic hit. And my dad, very early during the first wave back in April 2020, he was unfortunately taken by the pandemic. So I'm raising that because I was able to witness the lack of resources in long-term care home well before the pandemic. Pandemic has definitely and dramatically taken the life of many older adults, and it has worsened the challenges that healthcare workers have been facing for too long, such as the lack of personnel, lack of training, lack of resources. And allow me at this point to also express my sincere appreciation to the healthcare workers for their tremendous efforts throughout the pandemic. So, in light of the situation, the general public was shocked by the situation, but again, that's a situation that existed already well before the pandemic. The pandemic has only exacerbated the problems that the long-term care home were facing. So if I have the wish to express here is, let's hope that those lost lives are not in vain. Older adults and seniors don't have time for finger pointing. We need to be proactive in addressing older adults' concern, starting with long-term care, where there is definitely an urgent need to provide enhanced care through a major reinvestment. And the list, however, doesn't stop here. We can think about housing, not only from an aging perspective, but also from a climate change perspective. Too many eldest residents are not equipped with air conditioning. Think about income security, think about social inclusion and transportation, just to name a few. All of those need to be acted upon, and to properly address them, we need leadership to come up with a solid and coordinated national strategy. So on behalf of our three organizations, I am therefore looking forward to what the candidates have to offer in response to these challenges. But moreover, beyond your party's platform, I'm also interested to hear from the candidates what you would do to help move these important issues forward if you are elected. Thank you, merci. De retour à vous, Jean-Claude.
Merci, Yves. Lastly, I would like to say just a few words about my organization, the Ottawa branch of the National Association of Federal Retirees. We're delighted to be working together with the Canadian Association of Retired Persons, CARP, and the Council on Aging of Ottawa to organize these sessions. Notre association nationale a été établie il y a 58 ans et aujourd'hui, nous représentons plus de 170 000 membres actifs et retraités de la fonction publique fédérale, des Forces armées canadiennes, de la GRC, ainsi que des juges nommés par le gouvernement fédéral et à la retraite et leurs conjoints et survivants. Here in Ottawa, we serve over 33,800 members, and in the riding of Ottawa South, we have 3,606 members. Together with CARP and the Council on Aging, we share a vision for the future where all Canadians experience a safe, secure, and healthy retirement. As the name of our association indicates, we put special focus on protecting the pensions and benefits of federal retirees. We make sure that every government is aware if they are looking for cutbacks or savings, our association will vigorously protect the pensions and benefits that federal retirees have earned. Notre section se concentre également sur la formation et l'échange d'informations, surtout en ce qui concerne la littératie financière et le vieillissement en santé. Pour assurer la sécurité de nos membres et bénévoles, nous offrons des webinaires hebdomadaires sur Zoom. Nous couvrons divers sujets comme les placements, la rationalisation, le vieillissement chez soi, rester en forme à domicile et bien d'autres. Pour en savoir davantage sur nos activités, nous vous invitons à visiter notre site web à nafrottawa.com. Our association has 4 priority issues: retirement income security for all Canadians, a national senior strategy for all Canadians, universal public pharmacare, and much improved support, care, and benefits for veterans. For today's event, the candidates were asked to focus on a national senior strategy and the dire need for long-term care standards and reform and adequate funding for home care. The pandemic has exposed the terrible issues that residents face in long-term care, and its effects are not yet over. According to the Ontario government's website, over 41% of the COVID-19 cases that resulted in death between January 15, 2020 and September 2nd of this year were residents of long-term care homes. We lost over 4,000 seniors who are important members of their families and our communities. These are unprecedented times, and we need an unprecedented response. C'est pourquoi aujourd'hui, nous écouterons attentivement ce qu'ont à dire nos candidats. Nous voulons savoir comment leur parti, s'il est élu, réagira à cette situation sans précédent. So now is the time for the candidates to speak. I would like to remind everyone that we ask candidates to focus their remarks on 3 issues specifically. First, the need for a coordinated national senior strategy with dedicated funding and accountability goals. Second, the need for enforced principles and national standards for long-term care developed in collaboration with provincial and territorial governments. And finally, the need for adequate funding for home care to improve health outcomes and reduce costs. We provided the candidates with the positions of our organizations on these issues ahead of time, and now each candidate will have 5 minutes to tell us where they stand. We will be strict about enforcing these time limits. Erin Higgins from our branch will hold up a sign warning candidates that they only have 1 minute left. She will also interrupt if you do not see the sign. Because of the Zoom format we are using, we will not have an interactive question and answer period. After today's session, we will provide you with the email addresses that we have been given for the candidates, and you will be able to follow up on your own after the session is over. We are also taping the session and will provide you and the candidates with a link to this recording after the session is over. Our first speaker is the Liberal Party candidate and incumbent, David McGuinty. Monsieur McGuinty.
Merci beaucoup, Jean-Claude, and hello to everyone. J'ai eu le privilège depuis 17 ans et demi de servir comme le député ici à Ottawa-Sud. Évidemment, je rencontre des dizaines de milliers de gens aux portes depuis 5 ou 6 semaines. Je voulais faire référence aujourd'hui spécifiquement à plusieurs mesures dans notre plateforme. I'd like to also say that before beginning, I'm very proud of the platform we put forward. It's an 82-page, fully costed document and plan. It is the only plan that has been endorsed by Kevin Page, former Assistant Deputy Minister at Finance Canada and first Parliamentary Budget Officer, who is quoted as saying that the Liberal fiscal plan deserved a good grade for overall fiscal credibility. It will be important to keep that in mind as we hear from all of us today about the measures that we hope to bring to bear to deal with some of these important issues. First of all, I want to speak a little bit about what we're doing for caregivers. I'm going to enumerate a number of measures which are available to all participants today in our platform. We're going to be expanding the Canada Caregiver benefit, the credit into a refundable tax-free benefit. We're going to make the Canada Caregiver credit refundable, allowing caregivers to receive up to an additional $1,250 a year. We're moving forward on better long-term care. We understand that what has happened during the pandemic has tragically exposed long-standing issues affecting long-term care facilities across the country. And frankly, to the dismay of a number of provinces, we have announced we're going to work with the provinces and territories while respecting their jurisdiction to support seniors with an investment of $9 billion over 5 years. That will improve the quality and the availability of long-term care homes and beds. It will implement strict infection prevention and control measures, including through more provincial and territorial facility inspections, something I've heard from every long-term care and seniors residents in this riding. I'm told I am the only candidate who's actually been to all 12 to meet with the seniors since this election began. It's not unknown to me. I've been working with a number of these residences for a long time. But what I'm hearing is they need and want more inspections. As a result, and despite the protestations of the province of Quebec and elsewhere, we will develop a Safe Long-Term Care Act. This will set national standards to deal with the patchwork approach, which is now in place across the country. Next big issue. I hear from our frontline administrators in long-term care facilities like St. Pat's Home just last week here in Ottawa South, we need better working conditions for our personal support workers. That's why our government has announced, our party has announced that we're going to be doing two things. We're going to be providing funding for the training of up to 50,000 new personal support workers. Taken together with a raise, we're going to be raising wages for personal support workers, including a guaranteed minimum wage of at least $25 an hour. We understand it's important to recruit and to retain personal support workers. It is not only administrators of LTCs, but also residents who are telling me that they need that relationship with personal support workers just as much as the PSWs need the relationship in their work with the folks they are helping. Here's another measure. We're going to help bring different generations under one roof. We're introducing a new multi-generational home renovation tax credit to help families add a secondary unit to their home for an immediate or extended family member. They'll be able to claim up to a 15% tax credit, up to $50,000 in renovation and construction costs, saving up to $7,500 in those renovations.
Excuse me, Mr. McGinty, you have 1 minute.
Thank you. We've had an extensive seniors strategy in this country for the last 6 years, whether it was reversing the eligibility for OAS and JS to 65 from 67, the one-time payment of $500 in August to our OAS pensioners, et cetera, et cetera, et cetera, all of which is available in our platform. I would urge you all to take a look at it. We're setting up a 1-800 number to help seniors access government support. And finally, we'll be working hand in glove with our Indigenous communities to create a new framework for Indigenous long-term care across the country. I would urge you to take a look at the prudent, reasonable, and achievable plan that is laid out in our platform at liberal.ca. I'd welcome your feedback and a good advice. Thank you so much for attending, and thank you very much for allowing me to participate. Merci beaucoup.
Merci beaucoup, Monsieur McGinty. Our second speaker is the People's Party candidate who asked us to advance her presentation in our schedule. Shiloh Hall, please.
Hi, thank you for having me. I'm Shiloh Hall, and I'm the representative for the People's Party of Canada. I am a retired military member. I've worked for the federal government, and I've been a small business owner. I'm also a mother of 3 boys. And the biggest thing for me in this election is how the government has taken away our rights and freedoms without providing, any data or evidence to support the mandates that they've implemented on people. I mean, I hear about, front care workers and first line workers being presented with an ultimatum of taking a vaccine that they're very hesitant about, or they may lose their job. Where are we going to get these people to fill these positions? We are already shorthanded. So this is something that our government wants to address. In our healthcare, we have the worst wait times. We have our costs increasing at an unsustainable rate. We've increased our spending from $20 billion from 2006 to $43 billion, and it's not gotten better. Our wait times haven't gone away. We don't have, personal doctors for ourselves, like GPs for our family. It's very hard to find one if you don't have one. So where's all this spending gotten us? From the People's Party, we have a very good platform that is to address a lot of the overspending that we have, such as we want to remove 5 to 10 billion that gets spent on corporate welfare and bailouts. We want to stop the 5 to 10 billion dollars being spent on foreign development, and the billions of dollars being spent on our state-funded media. We want to bring that money back home to Canada. We want to use it for Canadians of all age, and we want it to prosper Canadians, because right now our deficit is so high that it's costing everything more money. Our inflation, I just read on a CBC article this morning, is targeted at 4.1%. We in the People's Party want to target at 0%, and we believe we can do this by stopping the hemorrhaging of money going out to foreign initiatives through the UN and spending on infrastructure for other countries. We want to make Canada better for Canadians. The other problem I have is that, we have had a proud history of military engagements over the world. Our fathers, our grandfathers, and those today who serve us in the military have, protected us from the governments that have, taken the rights and freedoms away from their own citizens. And this is what we are seeing today. We are seeing our government infringing on our rights, our government putting in ultimatums to Canadians without providing proper facts and data that can take away their job. Like some of these Canadians that I've spoke to door to door have talked to me about, teachers and nurses, that they are being presented with this very scary ultimatum of either taking an experimental vaccine that is not out of trial until 2024, or being faced to being without a job. I mean, it's unimaginable that us in Canada are doing that and presenting that to our citizens. And we as Canadians deserve better. We deserve answers. We deserve, our government to be responsible to us. It is against our Constitution, and we deserve, an explanation as to whether or not these measures have worked or not. I know within the pandemic, many seniors were abandoned in long-term care homes, which is despicable and disgusting. And we've seen it on all levels of government. They didn't address whether or not what they were doing was being effective. Was it helping, were we helping seniors? Were we helping the most vulnerable? Are the things that we're doing helping the most vulnerable? We from the People's Party want to address that, and we want to make sure that we are accountable and that we can make the lives of Canadians better, that we can incentivize Canadians, and that we don't have to worry about, maybe the possible sale of our house. I don't know if you've heard this, but the Liberals have talked about, getting in your pockets for the sale of your personal residence at 25%.
You have 1 minute.
Thank you. We've worked hard our entire lives to be able to pay for our homes and to be able to provide for our families. It is unfair for the government and take it away from us because of their overspending, because of their unaccountability to Canadians. I really suggest anybody that is interested in a fiscal platform, check out the People's Party.ca platform. It is very responsible and it is in the interest of bettering all lives of Canadians. And I really appreciate you allowing me to speak and be present at this meeting. And I hope that anyone that has any questions, please reach out to me via email. My email is ppchalloscandidate@gmail.com. Thank you so much for giving me this opportunity.
Thank you, Ms. Hall. Next, we will play the video from Ellie Tanis, the Conservative Party candidate. He asked us to share this video. He hopes the video conveys his sincere commitment to becoming an effective MP for Ottawa South and to maintaining his strong advocacy for seniors and their priorities. Any questions or comments can be sent to his email, which we will provide you and the other candidates' emails. Our next speaker is the NDP party candidate, Huda Mukbil. Ms. Mukbil.
Good afternoon, everyone. Bonjour tout le monde. My name is Huda Mukbil, and I'm your NDP candidate for Ottawa South. I'm very pleased to be with you all today. So the NDP's platform is to take for-profit out of long-term homes. We want to make sure that they are publicly funded and that we are not, these facilities, which too many seniors have suffered under, there needs to be a quality of care assurance, and we can only do so when it's not based on profit. We believe that an investment is possible if we're able to tax the very rich. So people who are making over 10 million, and corporations like Amazon, Netflix, and others that have made record profit during the pandemic. These organizations need to be paying their fair share of taxes so that we can invest in long-term facilities that are publicly funded, that are not profit driven. And also this will help us to invest in healthcare to ensure that our seniors are taken care of. In terms of pharmacare, my husband's a pharmacist, and too many people are now not taking their medications as a direct result of cost. And so we want to also ensure that we have a pharmacare program that's universally funded and available to all, including seniors. We also want to make sure that there are seniors that are uninsured, that don't have dental support, as well as vision care. And so we want to include that in our care. We understand that financial security is a concern, a major concern. And so we want to make sure that we're enhancing the old age security. We don't believe in creating a two-tier system for 65 and 75. We also want to make sure that we boost the guaranteed income support, as well as make sure that enrollment for both is activated right away automatically. And as well, we want to make sure that workers are supported with their pensions, that, when bankruptcy is declared, that people have us to fight for them to ensure that they get their pensions. Also, We want to make sure that we amend the Employment Equity Act and add ageism, because there are seniors that are working, and ageism and discrimination as a result of ageism is a problem. So we want to tackle that as well. And we want to make sure that we have the proper social support for seniors. So individuals that are taking care of seniors need to be financially compensated and provided with support. We also want to make sure that we tackle poverty. There are too many seniors that are suffering from poverty, and we want to invest in social programs and support systems to ensure that everyone is taken care of. I thank you very much for this opportunity to connect with you. I have over 18 years of federal government experience. I served at the Canadian Security Intelligence Service and as a strategic national security advisor for the CBSA. I know how government works and hope to be fighting on your behalf to make sure that we are investing in people, in seniors, rather than interest groups and corporations. Thank you.
Thank you very much, Ms. McBill. I apologize, I made a mistake. I introduced the video from Mr. Tanis, and then I moved to the NDP candidate. So I'm sorry about that. We will play Mr. Tanis's video right now. Thank you.
Good afternoon. Thank you for inviting me and for giving me the opportunity to provide you with information on how the Conservative Party supports your three priorities at this critical time during the election campaign. I would like to open by expressing my thanks to your members for your work to build this country and help Canadians in every walk of life by providing supports, infrastructure, programming, and stewardship. While we find ourselves in the midst of this unnecessary election, while simultaneously dealing with the challenges of a fourth wave of this deadly pandemic, we need to remember that this election is all about our future. It is about the next 4 years, about solutions to critical and complex problems, about enabling a strong and enduring recovery, and about accommodating the many changes that the pandemic has brought and which the color of our collective future. We need a plan to support our economic recovery. We need solutions for seniors. We need solutions for long-term care. And we need to implement a workable solution that will allow seniors to live in their homes as long as they wish to, and allow them to be confident that they will have undiminished access to the proceeds from the sale of their primary residence. We plan to implement policies that will expand employment across Canada. Bell Northern Research evolved into Nortel, and it became an international powerhouse. Even after economic reversals damaged its market, the patents, Canadian ideas, and innovations were sold at significant prices. The patents still had value, even though some were decades old. The Conservative Party wants to create specific incentives for Canadians to develop patents and incentives to manufacture these products in Canada. It is the kind of growth that will create substantial jobs in Canada and an expanded tax base that they can be used to support programming and increase health transfers to provinces, doubling from 3% to 6% to support enhancements in long-term care, mental health, and the treatment of addictions. Seniors with fixed incomes continue to face real pressures as inflation hits record highs and essentials like food and skyrocket in prices. When interest rates rise, the deficit and debt will increasingly cut into funds available for programming. Our plan has been evaluated by the Parliamentary Budget Office as capable of eliminating the deficit as soon as 7 years from now. Our debt has increased by $500 billion in only 2 years. There are specific plans to support seniors in Canada, recovery plan. Some will help seniors to remain in their own homes and amend the home accessible tax credit, allowing seniors or family caregivers to claim the medical expense tax credit. We will also introduce Canada Senior Care benefits for those living with and caring for a parent. The pandemic has exposed critical weaknesses in the long-term care system. Some of these weaknesses were identified by our armed forces personnel when they were brought in to help. A Conservative government is committed to fixing long-term care with the collaboration of the provinces, including increasing the funds available and the number of long-term care workers. We also have a strong focus on protecting all pensions, including private sector pensions, when the parent company faces financial challenges. Our plan will make it priority for companies to meet their pension obligations in any sale or restructuring of a company. I am committed to Ottawa South. My family and I grew a business here that employed over 150 people. In addition, my family and my business contributed over 1.5 million to charities, along with Karen's Place located in Ottawa South for people that face mental challenges. I commit to you that I will use the skills that helped me build my successful business to help small and medium-sized businesses to recover and adapt to the post-pandemic world so they can survive and prosper. I will also commit to staying in touch with you regularly, to report on progress, and to ensure that I understand your priorities as they evolve over time. Thank you. Vote Tanis.
On behalf of our three organizations, we will extend our thanks to Mr. Tanis for his presentation. Our next speaker is the Green Party candidate, Mr. Les Schramm. Mr. Schramm?
Hello, bonjour. I'm not going to talk to you about creating jobs and affordability and so forth. I'm going to stick strictly to long-term care and healthcare. So we all know that Canada's existing patchwork of long-term care has fatal structural flaws. Many long-term care residents in Canada still live in inadequate and inhumane conditions. But there's a need for improvements in healthcare generally, long-term care, pharmacare, hospital care, and access to medical practitioners. Even before the pandemic, we were faced with hallway health, insufficient numbers of hospital beds, physicians, nurses, nurse practitioners, and support staff. Long-term care has long been neglected. Before the pandemic, geriatric physicians were telling me that care in private, expensive private long-term care was no better than public long-term care. And COVID-19, by the way, proved the point. And many Canadians, including working Canadians, frequently have to choose between paying for food and housing or the prescriptions and dental care they need. We need more hospital beds, we need more long-term care beds, we need more at-home support, and we need more medical professionals, and we need national pharmacare. Health is, of course, the responsibility of the province. The federal government's role is to provide funding and direction. Many years ago, the federal government provided 50% of the cost of the provincial federal health accord. Today, the government funds 34% of healthcare costs, and that's a problem. It's a problem because the provinces have limited powers of taxation and can ill afford deficit financing. The federal government has much greater powers of taxation and can borrow at much lower interest rates than the provinces. In fact, the federal government can even borrow with no interest. The federal government must do more. And there is another problem. The training and licensing of physicians and nurses is the responsibility of professional associations, and they have not trained enough doctors and nurses for many years. So it's difficult to find a family doctor, a nurse, or a nurse practitioner. It's difficult to staff hospitals and long-term care homes. It's difficult to find home health care assistants to help seniors age in place. And the problem is going to get worse as more and more doctors retire. So the federal strategy must be to negotiate the provincial federal health courts that includes, as a minimum, long-term care, mental health, and ideally pharmacare, dental care, and vision care. The federal strategy must ensure that the court has functional and enforceable standards with the provision of sanctions up to criminal liability for violations. The strategy must be to include increased transfer payments to the provinces, both to cover current expenses and to build up hospital long-term care capacity. And we must increase the proportion of long-term care investment in community and home-based care from 13% to 35% in order to match the OECD average. In addition, the federal government should fund the buyout of for-profit LTC facilities and make the caregiver tax credit a refundable tax credit so the family caregivers have more flexibility and change the home renovation tax credit from 10,000 per household to 10,000 per person. The Green Party will increase federal funding by at least 5.2% until the federal government share of the health care spending is 50% of total spending. The Green Party will work with the provinces and the medical associations to ensure more medical professionals are trained. We will make it easier for students to continue their education by providing free tuition and ensuring they have a guaranteed basic income during training. Thank you.
Thank you, Mr. Schramm. Our last speaker is the Communist Party candidate, Mr. Larry Waslin. Larry, please.
Yes, bonjour et merci beaucoup pour l'invitation de vous parler aujourd'hui. Thank you also to the audience that is tuning in at the moment and perhaps down the road as well. I would like to also acknowledge that we are talking with you today on unceded, unsurrendered Algonquin Anishinaabe territory. My name's Larry Waslin, and like you, I'm a senior. I have spent 40 years of my life working in the healthcare sector. I was a critical care nurse at the Children's Hospital of Eastern Ontario for many, many years. And I also worked in critical care at the Ottawa Hospital. I was responsible for unionizing the Children's Hospital, the first union brought into a children's hospital in all of Ontario back in the 1980s. Dignity is what is so important to seniors like you and me. The election platform of the Communist Party is all about dignity for seniors, for workers, for women, for students, and yes, for the planet we call home. In terms of the critical priorities that have been identified, income support, a national strategy, and long-term care. In terms of pensions and increasing the livable wages of pensioners, we are calling for a dramatic increase in public pensions to a livable wage based on a $23 an hour average, and a reduction of the pension age to age 60. We are calling for the expansion of Medicare, which includes long-term care, pharmacare, dental care, vision care, mental health care, a demand that the Communist Party has had for well over 5 decades. And we're now seeing other political parties such as the NDP and the Greens taking up this call that we've had for such a long time. In terms of long-term care, there's been some mention about this, but the real critical element here is public ownership and democratic control of both long-term care and home care. We must, absolutely must, take the profit and the slaughter out of long-term care. So many politicians, Mike Harris for one, who are involved in the long-term care industry are making a killing in long-term care. But seniors, of course, are also interested in dignity for their children and their grandchildren. And a lot of the solutions to the problems that we're facing would be addressed by a full employment strategy. A full employment strategy would put people to work in home care. It would put a large number of people to work in long-term care facilities. It would put a lot of people to work in community services for seniors and many other vulnerable people. In terms of wages for workers, we are calling for wages we're calling for a 32-hour work week, which would also increase the number of workers employed. But that 32-hour work week would be compensated at the same rate of pay as a 40-hour work week. And the reason for this is that labor productivity has increased by 40% in the last 2 decades, but none of those benefits have gone to the workers. We're also calling for, and this is absolutely critical, 14 employer-paid sick days. So many of our workers have gone into long-term care. They want to do a good job. They want to work as hard as they can. They get sick, but they want to take a couple of days off to recuperate, but they can't because there's no they don't have paid sick leave. So these are some of the things that we are inviting you to think about. Another thing about paying for many of these programs is, for example, we advocate 75% reduction in the war budget, canceling the fighter jets and the warplanes and the drones, and devoting that money back into public service for Canadians. Thank you very much.
Thank you, Mr. Goslin. Nous remercions les candidats et les candidates de leur préparation et de leur participation à cet événement, et nous leur sommes reconnaissants de leur engagement envers les aînés de leur circonscription et de partout au Canada. After today's session, we will send you an email that will include the contact information to help you follow up with the candidates one-on-one and the link to the session recording. We will also include a link to a short survey to collect your feedback on this event and a link to the Elections Canada website that describes your options for voting. On behalf of the Ottawa chapter of the Canadian Association of Retired Persons and the Council on Aging of Ottawa, and the Ottawa branch of the National Association of Federal Retirees, thank you all for joining in today. Have a great day and please vote on September 20th. Merci de vous être joints à nous aujourd'hui et surtout, allez voter le 20 septembre. Merci.